There are moments in our life when we see nothing but darkness in our path. And I am Akriti Gupta. And for me, that moment was when I was 17, sitting in the hospital room, just coming to the realization that I am about to lose everything: my heart, my best man, my father. You see, the doctors had just informed us that my father, who had been fighting with blood cancer for the past 4 years, who we thought will surely survive, will surely beat this beast back, now had to contend with another life threatening force. The cancer had an ally, and this meant that my father had just 10% chances of survival. I was shattered with fear in my eyes, with tear in my eyes. I asked my dad, "What do we do now?" And he said, "Akriti, cancer cannot touch us as a family if we do not let it change our lives." And we did not. This man, with death staring him down, refused to flinch. From his courage came my hope. His struggle against the darkness dispelled my despair and paved the way for win over cancer. It would take us another month to formalize the process, but for the cancer patients, for the needy, hope finally had a name. Even with all my father's vigor behind us, we still had bigger demons to contend with, be it in form of his treatment or in form of the unaware. In the 21st century, I was presented with absurd questions like, what kind of surgery is chemotherapy? Or, your dad has cancer, right? How many days does he has to live? Or even worse, my mother was assaulted with statements like, "Please don't tell anyone that your husband is suffering from cancer. Else, who is going to marry your daughters? After all, you have two of them." At first, this all made me extremely furious. But sooner or later, I realized that one must choose their battles wisely. And I chose to fight against the unawareness. So, how fitting was it that our first endeavor with Win Over Cancer was the awareness camps? These camps are meant to educate the masses. We did it by organizing cancer awareness talks in colleges, corporates, industrial areas, slums, and rural dwellings. Eventually, we ended up designing campaigns that emphasized on behavioral change, nudging people to adopt practices towards cancer prevention and early detection. My dad's doctor, my amazing friends, the hospital, they all were helping us out in it. While all these efforts did net us amazing appreciation, but our true victory came in the very first awareness talk itself. When my dad, in between his chemo sessions, attended the workshop and shared his journey. The unwavering courage of my father inspired hundreds of people that day. It was just amazing. Although we were doing a lot of good, but still we were blind to our true calling. Although it was not for long. So one momentous day, my dad's doctor made a request to my mother. He said that, "Ma'am, now you run an NGO. Can you please look into one of my problems?" He explained, many of his breast cancer patients have to undergo mastectomy, which means one of their entire breasts is completely removed. Now, breast being considered one of the most feminine parts of a woman's body, losing it is a traumatic experience for them. It's a huge blow on their body image, on their self-confidence. Mental health takes a different kind of hit. Also, since a substantial weight is removed along with the breast, this creates a disbalance in the body, which in long term can lead to issues like dropping of shoulder. In worst cases, your spine can also get bent on one of the sides. Ideally, one should wear a breast prosthesis that has correct way to balance out the body back. But as the breast prostheses available out are too expensive, therefore they're unaffordable for most of his patients. So he asked us that, can you do something about this? So after doctor's request, we decided to do our very own market research and came to the unfortunate conclusion that what he was saying was actually true. There was no good quality prosthesis available in the market, which was also affordable. But what we saw here was an opportunity. And we decided to invent a breast prosthesis that is comfortable to use, has correct weight to balance woman's body, and gives the woman a perfect fit. But the most important goal here was to give utmost quality to the breast cancer patient in an affordable price. My mother's proficiency with fabrics and my youthful vigor made the dream team kickstart this project. My mother started experimenting with different materials that me and my friends unearthed from the local markets. It took us 6 months and a whole range of prototypes to come up with our minimum viable product. We presented this prototype to my father's doctor and they gave us an approval, and we started distributing it free of cost to the needy breast cancer warriors. But our journey had only just begun. We did not come this far to sit down. We came to run, to take it to the next level. We wanted to serve more and more breast cancer patients. Hence, I decided to approach AIIMS, the All India Institute of Medical Sciences. Now, when I showed up at AIIMS, I was pushed from counter to counter. No one was interested in helping me out. And I had no connections to that, someone could pull strings for me. With no connections, probably my words also didn't have weight in themselves. At one point, I was just frustrated. So one day on my way back from college, which was 15 minutes away from AIIMS, I thought to myself, Akriti, what do you have to lose in this? And the answer was nothing. That moment, I asked the rickshaw driver to take a U-turn and drop me at AIIMS. That day, I walked straight into the cabin of the head of surgery of the entire institute. All this while, his PA, a very sweet lady, tried in vain to stop me. But I had different ideas that day, Before I knew, I was already inside his cabin. The doctor was there. I asked, sir, can I have please 2 minutes of your time? And I gave him my elevator pitch about a product and how do we want to help his patients. Honestly, I didn't even have my product with me at that time. But I think he was impressed by my sheer audacity of my passion. He gave me an appointment. And the next day, he, along with his team, heard our pitch and reviewed our products. Fortunately, he also gave us a thumbs up on our technology in the very same meeting. The Apex Cancer Institute in India had just approved our technology. What a moment of glory it was for us. Without missing a beat, we sprung into action and started with free distribution of breast prosthesis and cancer bras at AIIMS that day itself. Now it's at AIIMS that we realized how big of a problem it was. One may think, after all, how many women have breast cancer? How many of them suffer from it? Probably a handful of them. But did you know number of women living with breast cancer in India is more than the population of the entire country of Bhutan? Or more of number of women living with breast cancer around the world is more than the population of Australia. Yes, this is how big the problem is. And over 60% of them, at least in India, would never have been able to afford a breast prosthesis without our help. The problem is big. People just don't talk about it enough. However, we also had our very own limitations. We realized we alone cannot do this. We needed help. We could try to make a difference in the world in our own capacity. We need not be big or do really big things to bring that change. But when we all are together, smallest of the contributions can make a huge difference. After all, the sea itself is made up of drops, isn't it? For us, our family and friends came forward. Soon the word spread and our friends and relatives started joining in. In no time, we had expanded from just AIIMS to numerous government and charitable hospitals across India. Now, this was happening in 2018, and I was in the last semester of my course at Delhi University and had two options. Either follow my dad's advice of pursuing an MBA or my dream of taking our work of helping cancer survivors to the next level. I had paths open for me in both directions. All I had to do was make up my mind and choose one. After a lot of deliberation, I decided to follow my heart and went to study social entrepreneurship at Tata Institute of Social Sciences. Now there, I didn't just get access to amazing knowledge, but a whole network of people who helped me to build something that would help cancer warriors across the world. Up until now, I had interacted with over thousands of breast cancer patients, but most of them were getting treated at government or charitable hospitals. At this, I got the opportunity to study in depth about the problems of breast cancer patients, the problems they faced from the time of their diagnosis, during treatment, and even the problems they face after it that significantly impact their quality of life. During the study, I interviewed the senior most doctors from the government and private setup, social workers and counselors working with cancer patients for the past 30 years. And I even interacted with nurses and patients themselves and their caregivers as to get the clearest of the idea of the life of people I was trying to help. And that's when I realized that everyone in India is working towards making a cancer patient survive. But hardly anyone is helping them to get back into the society with dignity. Hardly anyone is helping them to get rehabilitated with their lives after cancer. We are so worried about curing patients that we pay no heed to how they live after they have been cured or after they have undergone this invasive procedure. Someone had to make sure that these people thrive. So I did. With our NGO, which was doing amazingly well, we were able to serve the underprivileged. But a cancer patient is a cancer patient, right? Irrespective of their income or social status, they are vulnerable. This realization was the seed for CanFam, a social enterprise focused on enabling cancer patients, survivors, and their caregivers have the best quality of life. The problem areas identified via my research built a very strong foundation, and my professors at TIS, the alumni network, and incubators helped me to structure my organization for the future. Now, people often ask me, how did COVID impact your startup? And my response to it is, it did not impact us. Confused, right? Well, the truth is, we started CanFam in February 2020, just completed with registration process and the compliances. The moment we started working on our first product launch in March, we all know what happened. The first wave and nationwide lockdown. Gloomy times with healthcare systems collapsing, surgeries getting delayed, and cancer patients not being able to access the doctors. What could we as a young organization have done? But hope can be found in the darkest of times, if only one remembers to switch on the light. Going back to our foundation via my research, I knew the kind of problems cancer patients had been facing, the kind of help they must need. With these problems as base, we started crafting a series of webinars. The good part is, in my research, I did not just gain some important insights, but also it helped me to connect with the best doctors, counselors, and social workers working for cancer patients. I brought all of them together on board and we launched the series. Honestly, it was a hit. We not just reached out to cancer patients from India, but even from nations like Singapore, United Kingdoms, Bangladesh, Nepal, and Maldives. Our solutions were relevant. Parallelly, we launched a community of such patients where they could interact in an empathetic space, not one plagued with just sympathy. We created a safe group for them. It was a delight to see survivors empowering the patients and giving them courage to win over cancer. Our products also gained tractions. Our work with cancer, especially catering to the survivorship needs, became an award-winning concept. We were recognized by United Nations and received support from national and international foundations. Today, we have an all-women team spread all over India. Everyone in our team comes with their very own experiences with cancer, making us even more passionate about the cause. And together, we have globally impacted thousands of cancer warriors today. Today, the one giving this talk is the same 17-year-old girl who had nothing but fear in her eyes. And today, you see a young, a strong, and a passionate woman on a journey to revolutionize cancer survivorship and care in the world. On a journey to empower cancer warriors to live life, love life, and win over cancer. And how was this possible? Because of everyone who believed in me, who supported me, my very own strong net of connections. Thank you.